Hi, hi everyone. You see me wearing a mask. I believe you know that this video is taken during the time of MCO. Okay, you must take good care of yourself, drink more water, so that you can keep alert during these presentations. Okay, First of all, I would like to thank Edu-Right for this opportunity for me to share what is community pharmacy, so that you know how to choose a correct pathway. And how are we going to positioning ourselves into this economy? Hopefully this presentation is fruitful to you. Okay, let's continue. Okay, the topic that I'm going to share about is business versus pharmacy. You are familiarized with community pharmacy, right? Community, that means you find the pharmacy in your community. So when you go around, you go to the shop, you see there's a pharmacy opening there. Okay, we positioning ourselves doing business at the same time take good care of the patient health. Okay, so today I'm going to share the perspective in between. So what is pharmacy and what are we doing for our business? Okay, do you think that pharmacy should look like this? Okay, full of medication on your left, on your right. Are they supposed to be like that? No, I think this is more on hospital setting. So in community, okay, you can see variety of products. It can be shampoo, medications, all the things that you think you need to solve for your own health. Okay, and this is a prescription counter where you can get your medications. And this is somehow it looks like in our retail. Okay, so today's presentations, I have a few sections to share. First, self-introductions about myself. Okay, you have to know me. And history versus now in community settings. So back then, how the community pharmacy survived, and until now, what is the evolving part involved? Okay, and job challenges. This is the main points that I'm going to let you know and share it to you. Okay, and work-life balance, whether I still like my job. Is it working in community pharmacy is what you like? Is the salary okay? You got the job satisfaction or not? And the last, I will share whether I happy or do I regret choosing this pathway. Okay, about me, I'm a young with passion to help people and seek for better future. Okay, I think this picture is taken during my university time. Okay, look young. I don't want to put my picture, current picture, because you can see me during the video. Okay, and during that time, okay, I am actually a foundations. I'm still finding a correct pathway for me to further go in. Okay, during my foundation study, okay, I decided to become a pharmacy because I see that pharmacy is a very demanding service in community, or whether it's community or not, in hospital, in industrial, they need pharmacists. Okay, who and what that influence you to choose this pathway? Actually, it's a friend of mine who want to join bachelor in pharmacy. So we study foundation together, and somehow, yeah, yes, I get influenced by him, and I want to study pharmacy. What consultation you have done before pursuing pharmacy? Actually, it's my brother. My brother is a pharmacist as well, and the only mentor in school, because when there's a mentor in school, you know who you want to know more info. Like let's say you want to study pharmacy, so what is the procedure? What is the requirement? So there's a mentor in school that guide me through. What are you doing now? So after 4-6 years of studies, I am now become a full-time registered pharmacist in community pharmacy. So is about myself. Okay. Next, history versus now in community setting. So let you know a little bit about pharmacy. What is pharmacy? Pharmacy basically is the person with a pharmacy license to operate and sell medications legally. Okay, by selling a medication, we solve the problem of sickness. And some people they have fever, minor ailment, pain over the knee, over the body. Okay, we need a medication to solve it. Okay, until past years until now, we're still doing the same thing, just that we have we have evolved to become a more customized service. Okay, let you have a look on our earliest community settings, what they do and their behavior. They have a behavior of more to passive. They wait for the customer to come in, and customer get the medication that they want, they go back home. Okay, it's very straightforward. And they do compounding more actively, okay, by using a motor. Okay, you have to press the powder and mix with a solution, suitable solution to make into syrup and give to children. By the time they don't have like our commercial Panadol syrup, where they have to compound by themselves. They are more medication focused. People come to pharmacy, they only know one thing, they get sick. Okay? Until now, certain elderly, they still say like that. I have a patient, I have a customer when they come into pharmacy buy medication. Okay, after serving a customer, I will say, thanks, come again to our pharmacy. And what the patient said, and the customer said, why I want to come to a pharmacy again? Do you want me to get sick again? Of course not. In pharmacy, we have variety of products as you can see from the picture just now. Okay, so we have more service other than give medications. Okay, customer relationship still a very important during the days. Okay, and until now we still serve our customer with patience, okay, with empathy. We treasure the relationship in between. Okay, and until now pharmacists, what we do a lot more. Besides giving a counseling, medication counseling, we actively engage to our community. We sometimes we go outdoor. Okay, we can do school talk. We can do a public talk or health talk, especially during this COVID time. We go to a lot of school. We give talk about hygiene, how to wash your hand, and how to do a preventive measure. And we give voucher promotion to actively engage with customer, and hopefully they come to our pharmacy again. So we have two lessons in compounding, because in Malaysia all the medication is require a registration. So seldom we compound ourselves, okay, because all the compounding they require a GMP, good manufacturing practice. Therefore, we normally get from a certified GMP factory to get all our products, like the Panadol syrup, like a flu medication, and so on. And our setting is more on grocery store, like as you can see, yes, there's a lot of promotions. The label is very clear. We have a mosquito repellent, or the goyot, or the medication that need by a customer. Okay, and lastly, relationship is still the same as just what I shared just now. Okay, come to the main point. Four job challenge that I want to point out for you guys, and I want to share with you all. Okay, in community, we are the customer-based service. No matter how, you must be providing a thoughtful empathy and supportive service to your customer. In general, in simple words, I mentioned here, be welcoming, be knowledgeable, and be considerate. Okay, quality product is very important, but don't forget, customer experience is even vital. Only through that we will be able to provide a lifetime value to our customer. Okay, a good service is not a differential service. Okay, because in our service industry, we must provide a good service no matter how. Okay, a delightful experience expectation is a differential service. What I mean by delightful experience, okay, few example. Today a customer they come in when they just want to purchase a medication for their problems, example like flu. So you know that this medication is good for flu, so you give to the customer. Is the end of the story? Besides I give, okay, this one have to take 1 times a day. Okay, you are good to go. Okay. Somehow you provide a good service. Yes, you give what they need, but you did not provide a delightful experience. Okay, you must ask more questions. Okay, understand their needs, explore their concern, and give a suitable products. Okay, if you know that for flu, it's a viral infective infections, it can last until a week for a patient to fully recovery. So if you just give a medication, it's not sufficient because in studies, it mentioned that vitamin C can reduce the duration of these infections. Why not? You give this knowledge to your customer to know, share to them, and give them the option to choose. Okay, it's a delightful service. So your customer know more about their condition and what is best to suit them, right? Okay, so selling a medications with as well sell the supplement, we have to understand more knowledge on supplements so we can choose a suitable one for customer. Actually, I want to share another things, which is Joshi the giraffe. This is a story regarding an excellent service provider. Because of the time, it's better for you to go Google and search for yourself. And I believe from there you will understand what are they talking about, the excellent service. Okay. Okay. Secondly, innovations. Okay, innovation. What is meant by innovation? Okay, to build a great company, right? I mean a great company, we need to devote ourselves into innovating and creating new ideas, challenge the status quo. That means we don't want to maintain static from what we are right now. Okay, challenge is not only about accepting new tasks, it is about going the distance, creating value beyond the ordinary. Okay, maybe many people with high goals and ambition can achieve and more than willing to go extra mile, like hiking. Okay, we must have an objective. How high and which is the place to reach a peak? What kind of mountain we're going to conquer? What type of equipment we need to be prepared? If we just go to a small hill, of course, it will be easy to reach to the top. But if we're going to Mountain Kinabalu, you know that you will need a more prepared equipment, okay? And prepare yourself both physically and mentally. Okay, so this is innovations. Somehow you know the target that you want to reach, and we try to provide full of ideas and innovating to our team to give better solutions. Example that we are doing actually right now, okay? Besides selling, Besides selling medication, actually, pharmacy can do a lot more, like selling medical device. Example like hospital bed. Okay, sorry, it's not a medical device, it's just a normal medical equipment. Okay, hospital bed. Can you imagine how much the cost of a hospital bed? Okay, it can be out to 3,000, 4,000. But let's say if I put a unit in our store, do you think that how many patients afford to buy this hospital bed? Okay, we try. If you want to sell a hospital bed, okay, maybe 3 months, one customer come in to buy, or 6 months, one customer come in to buy. It's not a good investing a hospital bed in our pharmacy setting. But how are we going to challenge these problems? Okay, we put our innovations, we think ideas, how to push. Finally, we come up with a very simple words, very simple ways to promote renting. Okay, rent. We rent our hospital bed. Surprisingly, it is very effective. Within a year, not until a year, we already earn back the profit of 100%. Okay, within a year, we already earn the profit of 100%. Hospital bed, okay, by renting service is an idea, is one of the idea which is very good. Okay, bring special idea keeps the momentum for you to build a good company. Okay, the third one, retail management. Okay, this is all the full informations. A retail management in pharmacy. It can be a course of business where people study a business in university time. They learn all this. And for today's sections, I only going to summarize it. So in pharmacy, it can be a lot more that you can do besides sitting in the counter and serve the customer. We can go for a supply chain. Supply chain, that means that you have a organized ordering system. You order from your main HQ and supply to other retail pharmacy. Because currently I've been working in a chain pharmacy. Okay, we need to be strong in this supply chain. You have to be involved in visual merchandise, store design. So you can see that you like to go into the pharmacy with a poor design compared to a more grains, more lighting. Okay, it's an obvious answer. And we also have to learn about accounting, finance. Not that we learn, is that we hire people to do all this for us. Okay, to ease our job, store operations, human resource, need people to help you to product the products and give us consultation as well. Okay, and brand management and merchandising. Okay, brand management is more towards all the branding like Watson, like Guardian that they are doing right now. Okay, this retail management you can learn, okay, in any time. Okay, it can be from the book, okay, from the experience in when you work in community pharmacy. Next is price war and store ordering. Okay, this is normally it's very common that you can see in retail. Okay, when I start to do promotion, some other outlets they will look at it and give the same thing. Okay, it give promotion or give to a lower price. Okay, this is what they do. So you have to figure it out. How can you avoid price war? Okay. Avoiding price war is a very interesting topic. Okay, you can avoid customer perspective on the price, switch over to health matters. Like for example, today a customer want to buy certain thing, and he said, "Can you give discount and get a cheaper price for other pharmacy?" Maybe you can tell about more on health things. Okay, why you want to take this medication, or why you want to take these supplements? Are you going to eat by yourself? Okay, and we try to switch the perspective. Of course, some customer can be clever enough to detect this. Okay, but no worry, find a way to avoid a price fall. Okay, this is as well your job to do so. And always remember, don't throw price. Okay, so come to a last section. Overall, do you like this job? Of course, until now, from the things that I've been sharing just now, okay, from innovative, from retail management, for this stock ordering, price war, and also the first one is customer based service. Okay, income to customer, I really like that way instead of just sitting in the office. So overall, yes, I do like this job. Whether this job provide me a work-life balance, okay. From here, I discuss two things that is important in a work-life balance: salary and satisfactions. Okay, average current salary range on my current working experience. Okay, do you all like to know? Is 5 to 7K. It's based on 3 years experience. When you start coming out from graduate, it can be minimum 2K, 3K. Okay. Potential progression based on your company and what knowledge or skills need to progress. Progress. This means after this retail settings, if I want to progress to other area, where else I can go? Can I go to hospital? I don't think so, because the knowledge in hospital and retail is much more different. But you can open retail pharmacy. You can be your own boss, your own management. Okay, you can serve your own community with your patients, with your own ideas. Okay, innovations. No need to copy others. Do what you like, that you think is best for your customer. Okay, what progression related to professions available? Example, specialized pharmacy. Okay, you can become a specialized pharmacy. In Malaysia, we don't have really a specialized pharmacies, whereby when these specialized pharmacies can improve your salary. Okay, but maybe on your resume it will look better. Okay, but somehow if you want, you still can proceed. Example, wound care pharmacies, you can specialize in wound care. Some people specialize in kidney problems, so that when they go to when they're facing a problem with kidney problem, they refer to the pharmacist there. Okay, some pharmacies have expert in skincare as well, pimples problem, dryness problem. Okay, yeah, they can further going. This is actually an add-on service, add-on knowledge to you yourself. Okay, it's good for the company, and of course the company going to maintain you in as their worker. Okay, it's good to proceed a specialized pharmacy. You can go and learn. Okay, and last slide. Am I happy? Okay. When it comes to study as a pharmacy, during the study time, yes, I'm really happy. Although it's difficult, until I'm working right now, I'm still very happy. The answer is yes. Okay. Will you make a big difference if you know what pharmacy really does before embarking into any pharmacy course? The answer is, I think yes, it will make a difference, because you know your enemy. Your enemy is you yourself. Okay, you have to understand your interest, whether this course is really what you like. Do you think that you really like a customer-based service, or you prefer a project, or maybe one-off project like constructions? Okay, pharmacy. Yeah. So this is what I mean. You have to know yourself. After you knowing yourself, you know the course. You know the course whether it's suitable to you. If you think it's not, quickly switch to another one. Okay. Know first better than none. What advice for potential pharmacy graduate? Okay, if it is a challenging path, okay, to study a pharmacy, okay, if you care healthness in people, this is another way to serve. And you can still proceed to pharmacy, although the competition is high. Remember the 4 points that comes out. Customer-based service is important, innovation, and the basic management you have to know, and how to differentiate yourself from others beside price war. Okay. Okay, so if you have any questions and answer, you can always comment below, and I'm here to help you. Okay, thank you so much.